Still in the broad field of policy making, I just want to pick up next on the question of when something is drawn to the attention of a minister for them to note or to take a decision. And that's an issue that may assume particular importance given the evidence we heard before the break, that often it's the role of the minister to challenge and scrutinise what's being put forward. Now, a minister can obviously only do that if something comes to their attention. You've told us in your report, and it's borne out in the evidence the inquiry has heard to date, that there are no set criteria or guidelines as to when something will be raised by civil servants with ministers. It's left to the judgment of civil servants. How satisfactory is that in your experience?
I think it's very difficult to set criteria in stone for that, because it's a question of judgment. Not everything is scientific. Sometimes it's a question of judgment. So if you're a permanent secretary or a senior official, you've got to be asking yourself all the time, does the minister or the Secretary of State need to know about this? Is it going to look bad in the media, for example? Is it going to be a big issue if he doesn't know about it? How's that going to kind of affect our relationship? Because you let the Secretary of State down, obviously. Has the issue you're looking at got big financial implications, or even medium-sized financial implications? I was always asking myself, what I needed to put in front of the Secretary of State and the Minister, and I was always aware that if I got that wrong, the trust that we had between us would be damaged, and if you damage that trust, it's very much more difficult to do business. But I think it's very difficult. I mean, you could say, well, anything above that has a financial implication above X, it's not going to work like that, I don't think. Or anything that's going to affect so many people, it doesn't work like that. You need to be sensitive to that.
And I would agree with that. It's really, really hard to quantify judgment. It is thinking about what is the impact of something. Would the minister want to know about it? Now, sometimes, I don't mean you only tell them things they would want to know about. Sometimes they have to know about things that they'd rather not know about. But it might be something that is seemingly trivial, but the minister would want to know about it, therefore you would need to flag that up. Or it might be something that you think they might not want to know about it, but it's really important, you need to flag it up. But that requires enough communication between those in a position to take those judgments, whether it's at permanent secretary level or further down the food chain within the senior system, to have enough contact with those who are picking up information on the ground to spot that there is a problem and make a judgment. At what point does something trip over from being this might be an interesting issue to that's actually something that's a problem when we need to flag it up, and that's going to be different from subject to subject, from issue to issue. So it needs to be a judgment taken by someone who knows enough about the subject matter to be able to assess the seriousness of it, and say, we need to report that. You don't want to be reporting lots of trivial things, because it'd be like the boy that cried wolf, and people won't listen. So you need to have the judgment about when it is worth.
It's about political nous. That's it. A good civil servant has political nous, and that involves being able to put themselves in the shoes of a minister or a Secretary of State, which they don't always do, and think about how they would react if they'd not been told about this and it got into the public domain.
And political nous, but also subject matter understanding, so you can judge the severity of it and the ripple effect of if this is a real issue, this is how it would manifest itself, therefore it's serious. So you need to understand the subject matter as well.
It may be relatively more straightforward to say that something should go to ministers when the ministers are being asked to take a decision to do something, to spend some money, or to set up a new structure or organisation. What about the problem when the minister isn't being asked to do something, but actually they might want to do something if they knew?
I don't think there's a difference. I mean, I think, ministers need to know what ministers need to know about. and it doesn't matter if it's a new policy or something that's been around for a long time, which you think is not going quite right and you think the minister should know about that. I mean, I always say to people working for me, I don't want any surprises. I can cope with anything except surprises, right? And that was the basis on which I had a relationship with the Secretary of State I work for.
So should the decision as to whether to bring something to the attention of a minister, should it be either taken by or at least discussed with relatively senior civil servants? I don't mean the permanent secretary on every occasion, but you wouldn't expect necessarily, would you, is this right, junior civil servants to be saying, minister needs to know this, minister doesn't need to know this, without discussing it with more senior civil servants?
No, I would expect a junior civil servant to know when he should be going to a more senior civil servant and having a discussion about it and saying, well, I'm a bit uneasy about this, I think the minister ought to know about it, and getting some advice, some guidance from a senior civil servant. That's when, of course, you could get a situation where a civil servant is being told, no, you shouldn't do that, you don't need to do that. And if you're still feeling uneasy about it, then that's when you get into the realms of the Commission, ultimately.
Mm. Professor Benson.
I was just going to say, if I think about it from the sort of risk point of view, I'd be interested in knowing, if you thought it was relevant, in what the barriers are. It's not so much the criteria, but what stops people raising things they know about. I mean, this is a big issue in lots of other places, so I imagine that may be relevant also for Claire and Michael.
I think it's a really good point, and I think the same issues apply in that if you're a minister or if you're a senior manager or a senior civil servant, you can create a climate where people feel they can bring you the problems, or you can create a climate where people just keep them to themselves because they're scared of opening it up. And I've worked for ministers of both sorts. The successful ministers create a climate where you know you can go to them. The only thing is go to them early. Go to them as early as you can.
Yeah, absolutely.
I think that's right, and so much of it is that the personal culture that's set at the top of the organisation. Is this a blame culture? If you raise a problem, are you going to be blamed for? I'm sorry, I'm trying to think of a polite way of saying the phrase, but casting doubt on the pet project of the minister, or are you going to be seen as someone who's spotted a problem that needs to be solved? Not this is a problem, so we should abandon the policy necessarily, but this is a problem that we need to solve, and we need to solve it early so it doesn't create worse problems. And you need to have a culture where people feel able to speak and have the time and communication channels to speak to their senior managers to say, we're getting some strange results on this. Should we be worried about that? Does the minister need to know about that? But there needs to be that dialogue, and you need to create both the culture but also the space to have that conversation, and that can be very difficult in a
Senior civil
very
servants who
busy
are dealing
environment.
with ministers and Secretary of State ought to have the skills to be able to do that. And sometimes, you know, it won't be received terribly well, so you need to couch it in terms of, look, I know you're not going to like this, but I had a wonderful private secretary once who constantly came through the door and said, boss, I think you ought to know that. To the point where I said, if you ever do that again, I shall throw you out the window. But he's absolutely right, and we had a good enough relationship for him to understand I was jesting. But that, you've got to know how to manage the person. And that's why one of the reasons why civil servants get paid, I what I say, but senior civil servants get paid quite well. It's part of those human relations skills that they're getting paid for.
And then if we then assume there is an issue that is being brought to the attention of a minister, one of the areas that the inquiry has been exploring is when evidence from or recommendations from, say, expert groups are presented to the minister in such a way that they receive a consensus view. So they're told, well, this is the way the ultimate recommendation of this expert committee is. And the minister's not told about what might be dissent or minority opinions. How much is that a problem that needs to be addressed?
Well, I think where it occurs, it's a big problem because it's tantamount, for me, it's tantamount to misleading a minister. So it is a big problem. That's not to say I think it happens an awful lot, but where it happens, it is a real issue. Yeah.
So it would be important, would it, from your perspective, for ministers to know if there are dissenting voices on it?
Absolutely, and good ministers want to know. Good ministers want civil servants in front of them who are doing what we're doing today, is sometimes disagreeing. I mean, you know, if you get a band of 6 civil servants sitting around the table with a minister and they never disagree, I mean, the good minister spots that and thinks this is not right, and so would I. So yes, you should set out all the views, the significant views, and explain why an expert group or whatever group came to this conclusion. Now, Minister, you may have a different view, but my recommendation would be A, B, or C.
And I think one of the barriers to setting out dissenting views, I completely agree with everything that Michael said there, but one of the barriers to doing that is if ministers want very concise advice, it can be quite difficult to nuance the different views of an expert committee or a challenging situation, go into enough detail on each of them so you're explaining them whilst still being concise. So you need enough detail for people to understand the dissent and the impact of, so say you've got a report, there's a minority dissenting view. What's the impact? If the dissenting opinion is correct, but we've ignored it because it's not the majority view, what's the impact of that? And that's ideally what you should be bringing out, so that the minister can take an informed decision of, okay, so more people think the majority view. The risk, if they're wrong, is such and such, is quite serious, so perhaps I need to weigh that more carefully than actually the risk of the majority view being wrong. The impact is quite small, therefore it's a safer decision to go with that, even though there's a dissenting view. But all of that, and I've just waffled saying that to you, to say that to a minister who's dealing with huge swathes of different issues, they're not just going to be dealing with the one issue you're putting advice up. It needs to be succinct enough that they can grasp it quickly, and there's a real knack to being able to explain that succinctly and clearly, but precisely enough to enable the minister to take an informed decision.
And I think it's really important that civil servants and experts understand that sometimes a minister, or indeed a council leader, will disagree with you and your recommendation. And they're not just doing that to be awkward, they're often bringing into play different viewpoints. I mean, what does the community think about this? What do the people out there think about this? I've got to bear that in mind. I actually depend on them to vote me back into the job. So if you're the kind of civil servant that regards every negative from a minister as a personal attack, I think that's very worrying. I think, you know, experts, not just civil servants, but experts on groups need to understand that ministers are there as part of a democratic process, and sometimes they will use material and information that you don't have.
And equally, ministers need to understand that sometimes the reason advice is put up in that way is because that is genuinely the view of the person putting up the advice, that this is the right approach to dealing with things. And it doesn't mean that they're not going to implement what the minister decides if the minister wants to do something differently. But they've got to give their honest advice. And coming back to what's in the Civil Service Code, and in particular that point about not ignoring inconvenient facts. You can't ignore inconvenient facts when you're putting advice up. The minister is perfectly free to take their own decision based on that, because that's what they're there for. But it's crucial that they do that in possession of the full facts, rather than with advice being tailored to what you think the minister wants to hear.
And then can I pick up on the issue of ministerial and indeed civil service workload, and the extent to which there is time for reflection? If we could perhaps go back to the Making Policy Better report from the Institute for Government, RLIT 00011753, and go to page 12. I'm just going to pick it up in I think it's the 5th paragraph on the page, beginning, there is thus little counterweight. So there is thus little counterweight to the day-to-day pressures on ministers and civil servants, pressure to maintain a steady flow of initiatives, pressure to respond rapidly to events, pressure to keep decisions closed until they can be announced fully formed, pressure to place short-term departmental advantage over long-term collective benefit. The ministers, and by extension the civil servants who succeed in this system, are those who make a splash or manage crises, not those who oversee long-term result. So can I ask you first of all if you have any comments on that paragraph?
Well, I think I'll argue with the last sentence. I don't think the only ministers and the only civil servants who succeed are those who make a splash or manage crises. I don't think that's the case, and it certainly shouldn't be the case. I do accept entirely that the pressure placed upon a Secretary of State of a large department, or even a minister in a large department, and their senior officials is considerable and not always fully understood by the public. But actually, one of the tasks, one of the skills of the job is to identify the priorities. You can't do everything. You can't kind of deal with every single issue that's around the place. You need to delegate. You need to have ministers, if you're a Secretary of State, who you can trust and who also are good at prioritising, so that you're focusing on the things that really matter, whether they are political, whether they're financial, whether they're about communities and citizens. You just got to know. You've got to have game. You've got to have a bit of a nous, and sometimes you get it wrong.
And I would take a slightly different view on that. I'm not sure I would use the phrase "make a splash" or "manage crises," but I definitely think that the short-termism that's inherent in UK politics because of the parliamentary cycle. Ministers are focusing on essentially a 5-year planning horizon, whereas for something like health, you need to be thinking of a 30 or 40 or 50-year planning horizon. And I think the people who are good at managing those short-term things and responding to maybe not a crisis, but the ongoing handling issues of managing things in the news are likely to be more high-profile than the experts who are sitting boringly but importantly dealing with the stuff that needs to be monitored over a 20-30 year period to make sure that it works. And quite what the solution is to that, we live in a
well, I think we tried to pick up some of the solutions in the report, because I think it's a slightly separate point, and I completely agree with the point you're making. I mean, the fact is that the last time I looked at how long ministers stayed in post, it was 15 months. Now, that produces a huge pressure on the minister to do things and to do them quickly so that they stay in their job or, their career is enhanced. So there are an awful lot of pressures for short-termism in the system. I just hope that the people who succeed they're not just capable of dealing with crises or making a splash, because that would be disastrous. But we ought to be looking at ways in which we enable ministers to have a bit more stability. There have been times over the last 30 years when that has happened. If you look at the first 4 years of Blair's government after 97, all of the main secretaries of state stayed in place for those 4 years. And I think that degree of stability helped. It helped actually in dealing with departments, because they knew that this person was going to be around for 4 years, so they weren't going to be gone by next month. And if they knew the permanent secretary was also going to be there for 4 years, you had a degree of stability. So we need to be looking at ways, I think, in which we create greater stability within the system, so that people are better able to think about long-term planning and long-term results. And that goes for civil servants too. I mean, I made very clear to civil servants I wanted them to be in a job that, in a long-term project, which one of the questions you raised with this, I wanted them to be in a long-term project for 3 or 4 years, because I wanted them to be able to celebrate their success. I also wanted them to be accountable if things went wrong. And if you keep moving people around, there's never anyone that you can look at and say, what happened here? Or indeed celebrate success. So there are things we ought to be doing to make the system more stable than it is at the moment. It's not all about, in other words, shouldn't all be about political patronage.
That is, I think, an issue we'll come back to, Lawrence. We can take that down. Just again, on the issue of expert advice, I asked you about the importance of ensuring that dissenting voices from an expert group are conveyed to the minister, as well as perhaps the consensus view. What about the process of working out from whom the minister or the department takes advice. So again, an issue the inquiry has been considering is the extent to which you have the same voices, the same individuals on multiple committees, and then therefore you get the same advice essentially coming through, rather than having a broader membership and perhaps building in the existence of dissent or those who might be more likely to challenge the status quo. Do you have any observations on that?
I think groupthink is very dangerous, and both the minister and the senior civil servant should be trying to avoid it. Not just for the reasons you suggested, but groupthink also means that you're not very creative, you're not very innovative in the policy or in the delivery of it. So you need to get different views. At some point, someone's got to take a decision, and the experts are not always right. But you ought to be trying to bring in a wide range of different views.
A sort of like the US military approach of red teaming, where you've essentially got a challenge function with a parallel group of people who are there to question whether the experts are right, and different ways of doing things, and their actual purpose is to pick holes in things, because you don't want just to be building the consensus, because you do get into groupthink. Then you do want to say, okay, so what if that's wrong? What if that's wrong? What if that's wrong? That all takes time and resource, but it is a way of testing things. And how can you pick holes in things? And if it's relatively watertight, you won't be able to pick too many holes in it. But if you can pick lots of holes in it early on, you can try and solve those problems before you get too far down the road.
And this is the reason why, unlike most permanent secretaries, and it's not relevant to the inquiry in that it's after the events of the inquiry, I'm actually a fan of special advisors. I think special advisors can produce a degree of disruption and challenge in the system which wasn't there before. And so I think, as long as you maintain a good relationship with special advisors, I think they can be a positive in all of this. But you need something like that, either delivered from within the service or by someone like a special advisor.
Can I then just come briefly to the roles of chief medical officers and deputy chief medical officers? You've addressed them at bottom of page 19, top of page 20 of the expert report. We don't need to put it on screen, Lawrence. Do you, and this is really addressed to anyone in the panel who might know the answer to this, do you know how chief medical officers or deputy chief medical officers were appointed in the 60s, 70s or 80s?
I believe that they were recruited through processes that would have been overseen at the time by the civil service commissioners. This is before the commission itself had a statutory basis. Sometimes they would have been recruited internally from within the civil service, in which case it would have been without that external focus. Other times they would have been recruited from the wider medical world on merit.
And to what extent would the role of the chief medical officer or his or her deputies be one of being proactive rather than reactive? Is that something the chief medical officer may be better placed to do than a minister?
Well, I think it should be, yes. I mean, proactive and reactive cover a multitude of qualities and sins, but yes, it should be proactive. In many ways, they are much like a permanent secretary. They are a very senior player in the development of policy and indeed in the delivery of policy. They ought to be thinking all the time about what ministers need to know, how they're going to present the material to ministers. So yes, they should be proactive. And if I understand you, to not be proactive, if that means omitting to tell ministers something which ministers ought to know about, then that is close to being against the Civil Service Code, because you can mislead ministers by omitting to tell them things.
And do you know what mechanisms are or have been in the past in place regarding discussions between the chief medical officers of the 4 nations of the UK?
I know a little about this. That from my limited experience, they would talk on a regular basis. There have always been chief medical officers in certainly 3 of the jurisdictions. I can't remember when the Wales chief medical officer came into being, but from my limited experience, they have always talked on a regular basis. It's not the case that the English one is, and we'll come on to talk about devolution and hierarchy and so on in a minute, I'm sure, but it's not the case that the English one is the senior one, the others report to them. They're four peers who meet together, but one has access to greater resources than the others.
There's reference in your report, actually perhaps we will put this on screen, so Lawrence, EXPG 5047, and it's internal page 19, so I think electronic 25. So the bottom of the page, picking up third line down, you say this: they act as an interface between the government and medical or clinical professionals. Clinicians can always raise concerns by writing to their respective CMO, for instance. Do you have any knowledge of how often that occurs, the extent to which clinicians contacting the chief medical officer to raise concerns is a feature?
And I wouldn't know how often that would happen.
I don't know. I've not worked in that department, and I would need to have worked in the department to be able to answer that question.
It's definitely true in principle. Clinicians can do this,
Yeah.
but how frequently they do, I don't know.
And whether they get a response or not is another question.
Yeah.
That was my experience personally.
Can I then ask you to turn to the next page of the report? So it's page 21, 2 pages on, please, Lawrence. You were asked in response to question 23 to identify any weaknesses in the way in which decisions about health policy are made, and in particular decisions about the response to emerging health risks. And I just want to go through each of the weaknesses you identify. I'm conscious that there's, as well as this part of the body of the report, there's an appendix to the report as well, which sets out further views. So please feel free to dive in with responses. But I just want to go through each of these and just invite any observations. So the first item we have there is complexity and fragmentation of the NHS. The text explains that the necessary delegation of healthcare responsibilities to local government and various other bodies, trusts and organisations, while with its benefits, has resulted in different parts of the system operating increasingly independently. Effective collaboration and information sharing is the exception rather than the norm, partly because structures to facilitate it are underdeveloped, and partly because those working in the system are culturally adapted to working within their bubbles and may not know who they should be communicating with, what they should be sharing, or when. I don't know whether there's one of you who wants to jump in and help us understand a little more about that as a problem.
Well, it is. I mean, it is. I was leaving a space, but it is an undeniably complex organisation. It is undeniably fragmented, as the whole of our governance system is, not just health. And that does make it sometimes very difficult to get people involved, to draw out evidence that you need to use in discussion with ministers. So it's probably, as everyone says, the biggest organisation outside of the army, Russian army. But I think Professor Vincent.
No, I'll add a bit. I mean, yes, I suppose I didn't say much because that is the state of things. I mean, I don't work directly in the NHS, but it has an unbelievable number of agencies, and even to know just what the relevant agencies are, you know, who the regulators are, who is responsible for what, is very, very difficult, even for people working in the system. So it's quite hard when you're asking about, you know, detecting future risks and things, you know, to have a pathway for information that you could sort of rely on. Even that would be very, very difficult. And historically, I suppose people have, I'd have to go back, I guess people have made it more complicated rather than less over time. putting it
Professor
very
Armstrong.
crudely.
I think there are two sources of health policy in the NHS. One of them we've discussed, which is coming from the top, from the Department of Health, but also there's a lot of health policy coming from the bottom. That is individual clinicians making decisions, clinical decisions, in effect creating health policy, which then sort of rises up. Now that health policy is probably for most patients is the most important source of health policy, because that's where they meet the clinician, and the changing nature of diabetes treatment or cancer treatment over the last 70 years has been really profound in affecting those patients, largely because of that source of policy change. But because the policy emerges from the bottom, it tends to be very fragmented. So you can get, your diabetes might be treated very differently in the north of England compared with the south of England, because those different clinical policies in operation and how they work, they seem to work almost independently of what's coming down from the top. So I doubt if what a surgeon does today has been significantly affected by any of the reorganisations we've talked about. What they do on a day-to-day basis has evolved in its own way.
Professor Pollock.
I don't know whether this is a place to mention our appendix or not, but Appendix E, question 23, where we're in some disagreement on the list of weaknesses. And I think really up until 1990, the system was quite easy to understand and quite clear in terms of the structure and even the agencies, although there were a lot of agencies, but it was quite clear. But since 1990, the increasing fragmentation and, as you say, the introduction of market regulators, together with privatisation, means that we really don't know. It's completely incomprehensible to the ordinary member of public. You know, we don't know where to go, who to turn to, what these integrated care boards are. In the old days, you knew who your health authority was, you knew who you could go to in the health authority, and they were responsible for all the services in your area. Now you've got hundreds of different services and you don't quite know where to go and how to get care. And it's become increasingly fragmented as a result of a deliberate policy of constant reorganisation, restructuring, but also marketisation and privatisation. So pathology services are a really good example where you have dozens of companies entering into joint ventures with foundation trusts, and the accountability is really unknown, and you're very dependent on the operation of regulators.
I don't have such a rosy view of life before 1990. I think it was pretty difficult to access the health service. I mean, I'm so old, I go back to the 1974 reorganisation, and I remember, because I was in local government, trying to find out who ran the local health authority, and I was told, well, no one actually runs it because we've got three people. There's a triumvirate of leadership: the chief nurse, the chief administrator, and the chief medical officer. So unless those three agree, nothing much is going to happen. I certainly agree with your analysis after 1990, but it's an analysis which applies not just to the health system, but actually to governance more generally. It's incredibly fragmented and complex, and therefore very difficult to join up when you need to join it up, and you come on to talk about that.
Well, and I think the next weakness that's identified is the point Professor Pollock's just referred to, I think, which is the constant reorganisation of the NHS.
The reorganisations, of course, are an example of the short-termism, because if you're only going to be in job for 15 months, the best way of showing that you've done something is to reorganise something. I think we say in the report, I've certainly find it difficult to come across any reorganisation, structural reorganisation, that's delivered what it was intended to deliver. And I think the solution to this is that people should sit down long and hard to think about structural reorganisations. In the health service, they haven't just been reorganisations, they have been dramatic changes of emphasis. I mean, the difference between the marketisation changes in 2012 and the collaborative process structure that's now being put in place is monumental. I mean, culturally and in terms of behaviour, it requires completely different mindset. That is, I think, to the detriment of patients, to the detriment of the health service itself. So it's not just reorganisations, it's complete change of culture.
Well, I think
Perhaps
that's to ignore the abolition of the minister's duty to provide key services throughout England, the hands-off of Parliament, and the introduction of virtually compulsory competitive tendering, which has meant that we're seeing increasing privatisation and less accountability. And if I can remind you, Michael, before 1990, we did have things called community health councils. They varied in their strength, but there were different mechanisms for the public to get representation and to find out about services. They've all disappeared.
I think that's a different
and
issue.
You're left with a complaint. Well, we're talking about public accountability for the structures of the service.
Well, I think we're talking about reorganisations at the moment, and
maybe we're talking about different
I'm
things.
suggesting some caution before you go down the route of structural reorganisations. Community health councils were very variable.
They were.
Some of them had an impact, many had no impact whatsoever. But that's a separate issue.
And again, I'm going to pick up on the issue in particular of patient participation, public participation tomorrow. The next theme is lack of communication across government and between the devolved nations. I'm going to come on to the devolved nations when we talk about devolution tomorrow morning. Lack of communication across government is, I think, probably fairly self-explanatory and is something that has been picked up in your earlier evidence. If we just go over the page, turnover of senior staff. We talked a little about ministerial turnover. Again, that may be an issue that we come back to. But in terms of civil service staff, refers to the Department of Health having an annual turnover rate of approximately 15%. Is that higher than other departments, do you know?
Is the Department of Health higher than other departments?
In terms of turnover?
I don't have the evidence on, I wouldn't want to comment on that. It clearly is a problem right across government, because government or the civil service often puts the individual development of individuals, sorry, it's not very well put, ahead of the impact on the service. So you move people for their benefit so that they develop as individuals, but by doing that you may well damage a service or a policy area, and that happens too much in my view.
And do you know, you've referred there to the DHSC, so that's the Department of Health and Social Care in England. Do you know whether it's a similar picture in Scotland, Wales or Northern Ireland?
I don't know definitively. I would say it's likely to be similar, possibly slightly lower turnover, but unlikely to be very different. But that's speculation, informed speculation rather than factual.
Inadequate monitoring and reporting systems. There's reference there to the Cumberledge review. I want to pick that up tomorrow morning rather than do it at the tail end of today. So I'll come back to that. Likewise, lack of attention to the patient voice. I want to pick up in some detail tomorrow morning. So if we then just go to the next weakness you identify, limited scope for challenge and testing of policy decisions. We've obviously discussed that to a significant extent already this afternoon. But the particular point I wanted to ask you about is where you say in this first sentence, it can be difficult to make even the people who are in the room feel free to speak their minds in difficult decision-making conversations. How much is that a problem in government, and whether it's specifically in the Department of Health or more generally in government, and whether it's England, Wales, Scotland or Northern Ireland?
Well, there are different dimensions to that. One of the dimensions is that the civil service is a very hierarchical organisation. Always has been, still is in my view. And in hierarchical organisations, more junior staff are often disempowered and often feel that they can't speak out in a meeting. We talked earlier, I said that to some extent that depends on the culture that's established within the department by the Secretary of State and by the senior officials. You know, if this is a culture which is about getting the right decisions, the best policy, and dealing with things that need to be tackled and improved, then people begin to feel that they can make a contribution. If they're immediately slapped down when they make a contribution that's inconvenient, they won't do it again. So it is about culture, but in a hierarchical organisation, it's always a problem.
I think I agree completely with Michael. I think on the hierarchical side of things, I think things are improving, but they still have a way to go. I think there's still an issue with with hierarchy there. And hierarchy there can often affect who actually gets into the room. So this is talking about the risk of those who are in the room not feeling free to speak their minds, and there's a bit of an issue of hierarchy, a huge issue of culture. But hierarchy will determine who's in the room, and making sure that you've got the right person in the room. And it may be a relatively junior person who has the expertise in a particular niche issue that is needed. If you've got lots of niche issues, how many people is it feasible to have in a room to have a discussion? You can end up not having the right people there in the room. So I think it's still a problem, possibly on the seniority front less than it used to be.
Yeah, I agree.
Culturally, arguably, it may be worse.
Yeah.
Reluctance to act on a precautionary basis. We've discussed the precautionary principle. Unless there's anything any of you have to add to what's set out in that paragraph, I wasn't proposing to take further time on it now. If we go to the next page.
Except to say
yes.
that I disagree.
Yes.
We disagreed in Appendix E with that
Yes,
statement.
absolutely.
Of question 23.
And then lack of expertise in evidence and risk assessment. You make this observation in the report. Ministers are not trained in how to be a minister, on how to assess evidence and evaluate risk, on how to deal with pressures from the media, or on lessons learnt from previous responses to emerging health risks. And then you say exacerbated by the high turnover noted above. Leaving aside the turnover issue for the moment, on that issue of training for ministers, minister after minister has told us how they would turn up for the first day, and there's very little by way of training, briefing, instruction. It's just get on with whatever pressing issue is presented to their private office at that point in time. Is there a way in which that can be improved or addressed?
Absolutely. And I was running the Institute of Government before the 2010 election, and we ran training courses for, actually for the coalition as it turned out to be, but mostly for the Conservative people who expected to be ministers. And that was the first time in this country, I think I'm right in saying, that any training had ever been offered to prospective ministers. And it was welcomed with open arms. And I know the Institute of Government carried on, I don't know where it is now, but carried on working with politicians. It's not always easy. I mean, I had the same problem in local authorities, in that sometimes the training looks as if it's trying to teach ministers how to behave. In other words, how not to disrupt the system, when actually it should be about enabling them to assess risk, to challenge, to ask, and to be very clear about what it is they want to do. But in this country, I don't know about others, we've done nowhere near enough in terms of training and supporting and developing ministers and prospective ministers.
And in Northern Ireland, Ms Salters, what's the position there?
I'm not sure that there is any training for ministers there. It would be a similar arrangement. People turn up in their departments and are expected to get on with things. That's not to say that the departmental officials don't try to help new ministers coming in, but there isn't a sort of structured training program for them, to my knowledge.
The next weakness, and I just want to finish with the three further weaknesses on this page, if we may. The next is poor corporate memory. Decision-making weakened by poor corporate memory, with lessons learnt from previous responses to emerging health risks not recorded and passed on in any consistent way. Similarly, plans and policies developed under previous governments are not shared with incoming governments. Now, we discussed that latter point this morning, but in relation to the former point, how could that be improved? How could we ensure that lessons learnt from previous responses are recorded and passed on?
I think there's a responsibility on civil servants to help with that, and to encourage ministers to look at lessons from previous work. That is difficult when you have the disruption caused by a change in administration, but that's different if you have, as we've now had, 12 years basically of one party in government. So I think we could do much better at learning from what's happened in the past. I think civil servants should help with that and should present it in a way that ministers feel able to access rather than feel they're being told, what they should do and how they should do it.
I think I don't disagree with anything that Michael said there, but I think there's a tension in resourcing terms between that and juggling the turnover issue. If you've tried to improve turnover by keeping someone in post to see a project through to conclusion, within the civil service, the only way to get a pay rise is to be promoted, and to be promoted you need to have experience at a number of different levels. So therefore people are going to feel that they want to move on once they've completed their project. There often isn't capacity to keep them on for another couple of months to do a proper lessons learned review of something, and having the person who's overseen at a senior level the project, properly reviewing it, going through arguably with their team, what were the things that didn't work with this, what could be done better next time. There's a real resource in that, and both for the system that's wanting to move on to the next big thing that you want to throw people at, and for the individuals who may have been held back to work on that, to provide continuity there, a desire for them to move on. I'm not trying to excuse it, just trying to explain why quite often you've not got the appetite or the resource able to do the thing that you really need to do, which is sit down and pull apart what went wrong. And it's sort of with sort of humble reflection on, well, actually, if we had done this, that might have been better, or this was a great success. How do we make sure that we replicate that success? It's not always about how do you avoid failure, but in the event that something works really well, how do you make sure that that happens again?
I think the most important aspect of human memory is being able to forget. We've got to be able to forget things, otherwise we'd be completely blocked up with trivia. And I think the same thing could be said for corporate memory. They would if you promoted corporate memory, you would probably memorize all the things that are irrelevant, which are unimportant, and it would be very stifling for innovation. I think there's a case for forgetting corporate memory.
Sorry, Professor Vincent.
I was going to say, take a slightly different tack. I think this relates to what Michael was saying earlier, also about evaluation. That if you commission evaluations which you can commission from outside the department, to meet Claire's point, and if you put that in at the beginning of something you're doing, you're going to guarantee to get some sort of written memory and conclusion about what went well, what didn't go well, and so on. So I think it's not quite so difficult. I mean, I accept what David says about human memory, but that's not an efficient way of doing things. If you actually, I've been involved in a lot of things. You're always called in 3 years too late to evaluate things. It's ridiculous. And you know very well that you can structure things up front to create the memory you want.
I think the experience is that too many things are repeated and too many mistakes are repeated. I know what David is saying. You need to be selective. But I think the example that's set by senior managers within a department matters. And if senior managers take the time to sit down with someone who's been involved in a major project and say, okay, we've got an hour, what do you think we should learn from what's happened here? What's gone well? What hasn't gone so well? Then you begin to develop a core of understanding of the things you should avoid and the things that maybe you should do more of.
Should there be a requirement for policy decisions, a decision to adopt a policy, a decision not to adopt a policy, for there to be a clear documented record of that with the reasons for adopting it or not adopting it, the considerations that were taken into account, the material that was considered, so that there is almost a policy file which the incoming minister or incoming civil servant can access to understand clearly why decisions have been taken in the past and on what basis.
Yeah, and in a way that ought to exist anyway, because for heaven's sake, you go into any meeting of ministers and civil servants talking about a major policy issue, and there are an awful lot of people around the table who are taking notes. So there is a note taken of just about every ministerial meeting, certainly around the big issues. So you ought to have that material, whether it's always kind of shaped, put together in a form which helps you to understand why this was done, why that wasn't done, and what we kind of could learn from that whole process. I think you're probably right. It doesn't happen. I don't know what Claire feels about this.
And I think that's right, although I think your question presupposes there's always a conscious decision to do something or not do something. And I think I'm not familiar to the level of detail I would need to be to conjecture over the extent to which it applies to the subject matter that this inquiry is doing. Sometimes you drift into a state of things happening, not because you've decided to do them or you've decided not to do something else, but because your focus has been on something completely different, and that has just sort of continued to evolve without anyone taking active decisions about it. So I think for things where you've taken a conscious decision to do or not to do, Michael's right, there should be a record of that. But for other situations where they've been evolving and no one's been saying, okay, right, let's sit down, what should we do about blah, blah, there won't be that record because there hasn't been a decision as such. There's been an absence of a decision.
Professor Pollock.
Well, I suppose your questions presuppose that the government has a commitment, cares basically, and it depends on their ideological commitment and position. So, for example, if you take the pandemic preparedness plans for flu, it was highlighted there weren't enough ITU beds, there wouldn't be enough beds, there wasn't enough workforce. These issues have been highlighted over and over again for 20 or 30 years. So really the question is, why hasn't the minister done anything about that, and what's their ideological or value position towards the health service? I think it's as simple as that.
I'm going to pick up the issue of longer term planning and resource constraints at a later stage. So this might be the right moment to, bearing in mind the time also, to stop for today, sir.
Yes, well, we'll stop now then and come back at 10 o'clock tomorrow, if you please. 10 o'clock tomorrow morning.